You know, ladies, teenagers are wonderful folks, as long as they're somebody else's. You know, it's sometimes very hard to communicate with them when they're speaking teenager and you're speaking middle-ager. But we've found that it's that communication with regards to hormonal questions facing teens that is the critical factor. You play a major role in dealing with your teen with issues that could be bothersome to them, that may set the tone for how they approach issues of hormonal changes throughout their lifetime. So you have an important role. You can be a mentor to these folks. So I encourage you to take that by the reins and celebrate that with them, discuss it with them, and it can really make a difference in your relationship. Now, as an obstetrician and gynecologist, I get a lot of questions from women with regards to changes for teenagers. And one of the first questions I always get is, well, heck, when do I bring my teenager to the gynecologist? Now, of course, if you left that to the teenager, their response would be never. But there really is a few good guidelines that people need to understand. One, if they're not sexually active, and we can hope and pray that they're not. Two, if they're not having any particular problems, they really don't need to see a female specialist until 18, 20, that age group. However, if they're experiencing any problems with pain or problems with their cycles or issues of contraception, if that's a need, then it is very appropriate to bring them to a female specialist who can begin to set the tone for that interaction throughout their life. Now, along those same lines, another common question I get is, when does puberty happen and when should I be concerned if my teenager is not showing any signs, for example? Well, the average age of puberty in this country is about 12. Now, that's been going down as our nutrition and our body habitus has been changing. Girls are experiencing those changes earlier. If a woman has not had a period and not showed any secondary sexual characteristics like breast development or pubic hair, by the age of 16, she needs that evaluated. Now, if a woman has shown those secondary characteristics like breast development or pubic hair, but has still not had a period, you really don't have to be so concerned until maybe a little bit later, 17 or 18. It's very individualized. The other thing about cycles at puberty is very similar to menopause. Remember earlier I told you, menopause is just puberty with experience, so there are some similarities. Surrounding puberty, it's very, very common in the first few years of a young woman's cycle for them to be incredibly irregular, very unpredictable. Now, there are some women who will be cycling very regular from the very first day, but it's not uncommon in those very first few years to have 1, 2, maybe 3 cycles a year, and the same thing occurs in the perimenopause and the menopause. Those cycles become very irregular. In fact, for many people, that's the first sign of any changes. And it's due to this same process of not ovulating on a regular basis. And that's what creates the disruption in the cycles, both in young women and in the older women. The other day, a lady came in the office and asked me, you know, I've had terrible problems with PMS. Will my daughter have the same problem? And I thought that was really very wise. I think it was more for her protection, and she was in preparation than anything else. But we do know that there is a genetic component. There is the likelihood that a woman may experience similar PMS changes that her mother does. It's not a one-to-one correlation, meaning that it's not absolute. Interestingly, some of the studies have been showing that it's not so much the genetics as it is the modeling. A young woman sees her mother experience these changes, and that becomes her norm for what is normal. Consciously or subconsciously, she says, that is what happens to me as I mature. So it's critically important that you realize that you are forming that role. You are a mentor. You are a role model for that young woman. And much of her perception is built on how she observes and sees what happens in your life. I love the book of Ruth in the Bible. And in the book of Ruth, we see how an older woman can form many different roles for the younger woman. Naomi, Ruth's mother-in-law, is a friend. She's a nurturer. She's a mentor. All those roles that you can perform for this young woman as she matures, as she ages. And hopefully you can teach her to sidestep some of the pitfalls with regards to the hormones that you've encountered. You can take that education, that knowledge, that learning, that aptitude, and transfer that to her. You know, these are things that used to we didn't talk about. Menopause in particular, it's kind of interesting. Women never used to talk about that. Very seldom do women talk about PMS to their younger daughters. Well, it's critical that you do because they have so much learning that can come from that. So I'd encourage those communication lines to stay open because you can make an impact more than anybody else. Nurture and mentor those girls in your church. If you're in a group that involves some young adults, you can provide a tremendous scripturally based Christian worldview when it comes to some of these hormonal changes. Help these girls know that they are fearfully and wonderfully made, that they are unique, that this isn't a curse, that their cycle isn't something to be put aside and to be hated. It's something that truly makes them unique in God's creation. One of the things we talk about a lot with our teens is abstinence. And that's another issue that I think is critically important that can be tied into the hormonal discussion. When I talk to girls about abstinence, certainly I talk to them about the moral and ethical consequences. I talk to them from my lens of the biblical perspective. But I also talk to them now about the consequences. When we think about sexual activity, years ago, the bad outcomes were things like unwanted pregnancies or possibly you could get a sexually transmitted disease. But in most cases in that generation, you could take an antibiotic or get rid of it. It's not the case now, ladies. There are a couple of things out there now that are sexually transmitted disease that you can't get rid of and that can kill you. Things like AIDS. Things like HPV or human papillomavirus. That's a tremendous epidemic proportion in our young adults now. And it is one of those viruses that's associated with problems with changes in cervical dysplasia or precancers or abnormal pap smears. So it's no longer just moral and ethics, although that's the cornerstone it's built on, but you're talking about life and death with these young women. It's that important. Are there any questions? Yes, ma'am.
Mine is not so much a question as it is a comment. I have two teenagers, one a 16-year-old son who have absolutely no patience with me at all, and a 14-year-old daughter who seems to sympathize with me. She started her menstrual cycle at around the age of 12, and we talk about it. She's very open. She's not shy at all. She can even speak with her father about it. She walks in the room and talk about it as if it's no big deal. And I think I've accomplished what you were speaking about earlier, about making her comfortable with herself and making her realize that this is not a curse, but just a part of becoming a woman.
That's wonderful. I'm so glad you shared that with us because that really encapsulates what I was talking about. Is it really becomes a family issue. And I'm glad you brought up your son because that really is another component we didn't touch on, but there is some interaction and none of this stuff happens in a vacuum. It happens in a family unit. And I think there are a time and place where that can be discussed, certainly more importantly between the mom and the daughter, but I'm glad your husband actually plays a role too. You know, one of the other questions that I get very commonly is, well, what kind of nutritional changes do I need to recommend? Is there something I can get my teenager and my daughter doing right now? And one of the most important things you can do is begin to help them understand about a thing called body image or body concept. One of the biggest problems we have in young women with regards to some disease problems are things like anorexia and bulimia. Everybody's familiar with those. Those are not medical problems, those are psychiatric problems because there's a problem with their body image. They have a real difficult time understanding what's normal and what's not. And in our media and our culture, oftentimes we get different viewpoints. So that's another role as a mentor that you can play, is helping your teen, especially your girl, understand what is normal and what is not, and helping them to see what's a normal body image. Get them in the habit of exercise. I know I keep going back to that, but it's so important. If they establish the habit now, they'll continue that throughout their life. Good nutrition starts now, continued throughout the rest of their life. You can make a difference. Thanks.
Thank you.